One section of our standards is about ongoing training and education, and this section explains what we think all the doctors, nurses and other professionals need to do to make sure they are ready to give the best possible care to patients. What we heard when we talked about this was that it's important not just to get really good training in the skills you need to do surgery and nursing, but also to be able to talk and listen effectively to patients, their carers and families. As CHD is quite rare, many doctors and nurses won't see many CHD patients unless they work in a specialist centre. So it's really important that people who do not work in the specialist centre still have the opportunity to keep their skills up to date. One of the advantages of networks is that they can play an important role in making sure the correct training is in place for the right staff at the right time. There will also be some nurses whose main job it will be to educate and train others. So with these standards, we want to make sure that the right staff have the right skills to provide the best possible care for patients. What's really important when we design a new service is that we've got the service right and that it's working well. Testing this is what governance and audit is all about. We expect doctors and nurses, as an everyday part of their job, to look at the work they're doing and ask themselves the questions: are we doing this as well as we could? Do we understand why it's working? And if it's not working, what is the problem? When we talked to people, we heard that too many operations were cancelled at short notice and that reporting structures are not as good as they could be. It's important, not just that the clinical care is good, the service also needs to be well organised. With all that in mind, we've come up with some standards which propose an end-to-end process to make sure the service is as good as it can be. It's really important that there is good information sharing and that all of the information for all of the centres in the country gets captured nationally, and that there is one place where it is all recorded. It's also important to make sure that the results don't go into a black hole, but that doctors and nurses use the results to make their services even better. So we want standards to help patients be confident that they are getting a really good standard of care. And we also want people providing the care to look at their own services and hold each other to account for providing an excellent service. Because CHD is rare, and because it is right at the leading edge of technology, it is important that in the NHS we share our learning and learn from others. So we have a section all about research. We say that all of the networks being set up need to have a plan for how they're going to do research and how they're going to contribute to research. Many of our heart surgery centres are very closely linked with universities, so there is lots of opportunities to work with people who are skilled in research. So we want an absolute commitment that the congenital heart service in the future works closely with universities to make sure that we do the research needed to make our service even better. Finally, we have a section on our standards all about dental care. This is because we heard that for patients with CHD there is a risk of something called endocarditis, which is a heart problem which often starts with an infection of the gums. So it's really important that people with CHD get good dental care and advice. Our standards require all congenital heart networks to have a clear pathway for urgent dental assessments and access to appropriate facilities and expertise to provide the necessary care. We believe that these standards will not only help us detect and diagnose patients who are at risk because of dental issues, but they will also help us provide the necessary care following this diagnosis.